Welcome, everybody, and thank you for joining us for the second session of our Future of Healthcare Community of Learning series. Today's session is Smart Health Access, the Rise of Wellness Vending Machines. We're joined today by two speakers who are doing this work right now in urban Indigenous communities. And before I turn over the mic to them, I have a few quick items to share. My name is Liz Best. I am the Manager of Technical Assistance here at NCUE. And joining me from the NCUE team are Amy Lord, our Senior Communications Associate, who will be helping with slides, and Alyssa Smith-Longy, who will be helping us monitor the chat box. We are so honored to have everybody join us today. Next slide, please. Today's event is made possible by the Indian Health Services Cooperative Agreement Funds. It is the sole responsibility of the National Council of Urban Indian Health and does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. And for those that are unfamiliar with NCUE, here's a little background. NCUE is a national representative advocating for the 41 urban Indian organizations contracting with the Indian Health Service under the Indian Healthcare Improvement Act. NCUE strives to improve the health of over 70% of the American Indian and Alaska Native population that lives in urban areas supported by quality healthcare centers. Next slide, please. And without further ado, we're thrilled to be joined today by Johnny Delgado, a Grants and Program and Project Director at Bakersfield American Indian Health Project, and Dr. Ashleigh Herrera, an Associate Professor of Social Work at California State University, Bakersfield. Take it away. Next slide.
Thank you all for joining us. We have a short slide, not too long, with some questions, both for questions in the end. If we go to the next slide, I'll let Dr. Herrera kick it off.
Hi, good morning, everyone. Thank you for making the time to join us and hear about our Wellness Vending Machine project and how we have started to roll this out in the community through a community academic partnership. When we started to look at some of the responses that might be helpful to addressing the needs of our community related to the opioid epidemic as well as infectious disease, we started to explore wellness vending machines. And so we went to the research to see what's been done, how have these been working. And actually, they're not a new intervention at all. They're about as old as I am. They were first implemented in Europe and Denmark in 1987. And since then, they have spread throughout Europe and then Australia, and then finally coming to the United States in 2017 to Clark County. That's when we got our first stateside health vending machine. And to date, now in 2026, there's just been a proliferation. Now there's over 600 machines that we've been able to identify through web scraping and lots of research assistants spending time online. But many of these machines are operating through the U.S., both in urban Indian health centers and then tribal communities as well. So this is taking off, across our country. And the evidence is really strong, right? We've seen associations between these machines dispensing naloxone and a decrease in opioid-related overdose deaths. We've also seen, depending on the program model, if they dispense sterile syringes, there's a decrease in syringe sharing in those communities, increased access to syringes, and then an associated decline in HIV incidence rates. So really powerful. They also have this potential to decrease health disparities. What's recommended for models, if you can install them in a 24/7 access point so that there is a high level of availability throughout the day, depending when folks need them in events of emergency or gaps in care and access. And then when the models, allow folks to use them in an anonymous way to decrease stigma and barriers to use. And if you'd like to read more about the research and the evidence for these interventions making those strong arguments, you can scan the QR code for a complete list of references. Next slide, please.
So purpose on why BAIHP chose to implement a harm reduction vending machine. Native Americans experience the highest rates of drug overdose deaths in the United States. In response, we've established the Wellness Vending Machine to promote community health and well-being. The Wellness Vending Machine provides stigma-free, evidence-based supports that help reduce overdose deaths, prevent infectious disease transmission, connect individuals to care, and encourage overall wellness. It reflects BAIHP's commitment to Indigenous values, compassion, and public health best practices, guided by federal, state, and local recommendations. Recognizing harm reduction is an effective, community-informed approach, and it helps prevent deaths. Our key considerations were unmet needs, wellness and culture, stigma-free, and access. There's a link at the bottom that you're able to use to have some key findings from the CDC as well. Next slide, please.
So what we can see is that there's a clear case for unmet needs in Native communities. We know that Native American and Alaska Native populations have some of the highest rates of overdose-related deaths in the United States. We're looking at this population rate, it's about 65 per 100,000 in 2023, which is near double the rate of non-Hispanic white people. Unfortunately, we know that there's huge gaps in care and access, so only a small fraction actually are able to access the specialty SUD treatment services that they need, about 5.3%, which is the lowest of any racial or ethnic group here in the US. So even though we have this really high prevalence of both substance use disorders and overdose deaths, folks are not being able to access the care that they need and deserve. So there is this call for accessible and culturally appropriate interventions to mitigate these extreme losses and hardship in the community. And similarly, we see these types of trends around elevated HIV risk and treatment gaps as well. AIAN populations have a higher HIV burden compared to white populations. So here we're looking about 10.6 per 100,000, which is twice the rate that's observed amongst white populations members. And unfortunately, AIN people also have the lowest level of knowledge of HIV status of any racial or ethnic group. So we were seeing limited awareness and access to PrEP, particularly among AIAN populations who use drugs. And a lot of these barriers are related to not knowing where to get it, fear related to discomfort, judgment, and privacy in healthcare settings. And then this is particularly pronounced amongst those living on tribal or reservation lands. Structural and community barriers as well. So geographic isolation is a consideration, limited healthcare access, particularly on tribal lands and rural reservations, socioeconomic inequities, and then structural barriers related to prevention, treatment, and harm reduction services. And then at the same time, combined with that high exposure to potent synthetic opioids like fentanyl, increasing the overdose risk. And again, it speaks to the need of how can we try to fill these gaps in ways that are creative, low barrier, and sustainable. Again, speaking to why we think the machines are a great access point to start engaging people with information, but also resources needed to promote their health in a way that centers their dignity, respect, and autonomy. Next slide.
So wellness and culture, and we keep wellness and culture at the basis of all the work that we do as a clinic. It's important that we recognize, alien identity and right to self-determination, as well as the history and culture of the permanent community we serve, which is all together. Wellness is understood as a holistic state of well-being that encompasses physical, emotional, spiritual, and cultural health, reflecting indigenous concepts of balance, harmony, and wellbriety. Wellbriety is rooted in indigenous teachings and emphasizes healing of the whole person through connection to culture, community, and purpose. This approach recognizes that health interventions are most effective when they are culturally grounded, strength-based, and community-centered, honoring both traditional knowledge and evidence-based public health practices. The Wellness Vending Machine embodies this philosophy by providing stigma-free, evidence-based resources that support overdose prevention, reduce the transmission of infectious disease, and promote connection to care while honoring the dignity, autonomy, and self-determination of each individual. Framing the initiative around wellness rather than solely harm reduction enforces a positive, empowering approach consistent with Indigenous values of compassion, respect, interconnectedness, and wellbriety. By intentionally integrating culture into the design and delivery of health services, BAIHP ensures that interventions are not only effective, but also meaningful and acceptable to the community, fostering trust, engagement, and long-term health and well-being. Next slide, please. So stigma-free. BAIHP is committed to providing stigma-free access to health resources. The stigma surrounding substance use and harm reduction can discourage individuals from seeking life-saving services, worsen health inequities, and erode trust within the community. While harm reduction is a well-established public health strategy, the term can carry negative connotations for some community members. Referring to this initiative as the Wellness Vending Machine emphasizes a positive strength-based approach that aligns with BIHP's mission, values, and community center philosophy. The Wellness Vending supports a non-judgmental and respectful approach by providing anonymous access to naloxone, drug checking supplies, and other wellness items. Staff interactions prioritize compassion, confidentiality, and autonomy, ensuring that individuals feel safe and supported while accessing resources. By centering care on dignity and respect, the Wellness Vending Machine fosters inclusive and equitable access to essential health services, consistent with BIHP's commitment to Indigenous values, holistic wellness, and evidence-based public health practices. So rather than promoting harm reduction, we're promoting wellness. Next slide, please.
So access is really important as well with the wellness vending machines. Johnny's Machine is actually part of a local network of vending machines, so folks in our community can use any of the machines that are in this network. With using one PIN number that is assigned to them. It's entered into a software portal, and they're able to go anywhere in the county that has a machine that's participating in this project and be able to use it, so that we're decreasing barriers to being able to access supplies people need to be safe and healthy. Folks have different choices about how they'd like to register. They could do it online by scanning our QR code, filling out a brief survey, giving us about 24, 48 hours to be able to set up their account online. Or we have a warm line that they can call and text, and then we can do that on the spot with setting up their account. We also recognize not everybody would want to contact us either through a survey or through the warm line, but might need naloxone. So we have a universal code 999. If you push that, you're able to access naloxone on demand. And there's no delays, because really, in the interest of public health and public safety, we don't want there to be anything standing in the way between people being able to carry life-saving naloxone. But to access all the other supplies in the machine, they would need to move forward with the registration process. So we really work to balance safety, confidentiality, and equity. And then because this machine does dispense safer smoking and safer injection kits to be in compliance with laws here in the state of California related to syringe service programs, this machine is registered with the state, with its location. And so folks do have to be participants in a syringe service program, which means why we had to create this registration process at all, so that they are protected and that this is not viewed as drug paraphernalia, but health supplies to prevent the spread of HIV in our community. This machine is located indoors, and so folks are able to access it during the regular clinic hours, and the staff provide the guidance and support to help them, start the process of registering and using the machine, and really treat everyone in a way with centering respect and a non-judgmental approach to care, which has been really important. But, it's convenient, it's anonymous. You don't have to give anyone their name during the registration process. We don't ask for that. We just help them to create a PIN, and if they're open to giving us some socio-demographic information, overdose history information, to help us understand if it's making an impact, that's great. If they say no, they don't want to provide any of that, no problem. You still can get the PIN code. So again, really centering choice and trust, knowing that folks don't want to be providing some of that very sensitive information, especially if they're using drugs or people in their social network are using drugs, again, to decrease any stigma or shame and mistrust, especially of healthcare systems. Next slide, please. And just sharing a little bit about what we've seen preliminarily in our community here with wellness vending machines. We had one machine, it wasn't Johnny's, but it was located here. And initially there was restricted access for only registered users, and there were daily supply limits. And that model changed, and they moved to this unrestricted access point. You can see that's where that bright red line is showing up in August of 2023. And you can see that the utilization really increases once there were lower barriers to being able to access the machine. And that also led to increased naloxone engagement as well. And you can also see what supplies were popular in our community. That's going to vary community to community. These machines, you can stock them with whatever feels best aligned with your tribe, with your elders, with your community. But we really saw that the lower barrier approach led to improved engagement, especially around life-saving naloxone. And if you want to read more about it, we have our manuscript that was recently published. So as you're designing it, what supplies can you leave unrestricted? How can you have higher caps on supplies if it's sustainable and you have the funding to do it? Because it's clear that so many of our communities are under-resourced and are in need of these supplies. And when we provide access to resources, people are interested in engaging and improving their health. Next slide, please.
So what's in the machine? Naloxone overdose naloxone kits, safer sex kits. That includes condoms for men and women, as well as lube. Hygiene kits. They usually come with shampoo, conditioner, toothpaste, a comb or a brush. We have a couple different kits depending on how many pieces you put in there that are ordered through another website. Wound care kits, essentially the first aid kits. There's some gauze, there's some antibacterial like Neosporin, whatever the actual technical name is called for it, some bandages in it. Menstrual hygiene kits. We use the name menstrual hygiene kits rather than saying feminine hygiene kits, just to be more, how do I say, diversity focused. Not everybody who menstruates is a man, with that respect, so we chose that name instead. Sharps disposal containers. The vending machine itself serves as a syringe exchange program as well. We actually have a box right next to it where they could drop in their used sharps. And the containers they get can be from the vending machine. They put their old ones in there, toss them, and they get new needles if they need them. Which is the safer injection kits, safer smoking kits, safer inhalation kits, fentanyl and xylazine test strips. I'm not sure if xylazine is facing everybody in our communities across the country, but we definitely know fentanyl is the main one there. Xylazine as well. We wanted to make sure we included those. Anchor boxes. The anchor boxes were donated by the local county behavioral health agency. They're basically suicide reduction boxes. They're blue boxes with an anchor on them. And essentially, there's reasons to live in there. If anyone wants information on that, we can always share that. But we have positive affirmation cards that were written by the behavioral health staff from the county, and then we had our own staff write positive affirmation in there as well. Uh, Plan B, it's the over-the-counter Plan B. The Plan B is not hasn't been installed in our Bakersfield machine. We were able to acquire that from the state at no cost, and we're going to include that in our Lake Isabella facility location on our vending machine once it gets up and going. It's been delivered. We just have to schedule the install for the supplies. And in the Lake Isabella machine, we'll also have smudge kits, the little kits we ordered online. They come with a bundle of sage, a little abalone shell in there. And we want to make sure that people have access to traditional medicines. And then HIV STDs test kits. We got some donated from Crib recently. I'm going to order some as well to support with that. Dr. Harris program is going to be providing some as well for it. In those machines, we know that there's a rise of STDs and HIV in communities facing SUD, high rates of SUD especially. And we want to make sure we have those supplies in as well for harm reduction purposes. Next slide. These are pictures of the machine. The one on the left is the machine that was purchased by Anthem. That's going to go in our Lake Isabella clinic. And that one's actually a refrigerated unit. That's why it looks such differently from the one on the right. The one on the right was actually purchased by Aegis. I saw someone in the chat here that is from Aegis as well. So thank you for the machine, Aegis. And that's the machine we have here at our Bakersfield facility. As you can see, the packages themselves are discrete, so you can't tell what item they're going to be getting. And that was part of our stigma prevention strategy, is that you don't know what they're getting. They could be getting Narcan, they could be getting needles, they could be getting a menstrual kit, a hygiene kit. You really don't know. The anchor boxes really didn't fit in a bag, so we kept them as they are. But what's unique about the anchor boxes is that it doesn't have to be for yourself. It could be for anybody. So anybody who asks about it, we'll let them know. And then with the design of the machine as well, the colors and the graphics were all based on, traditional practices though. Of course, the ribbons, the colors stand for things. We want to make sure like the mental health ribbon was on there, the overdose ribbon, suicide, and addiction recovery. And of course, we have the semicolon. The semicolon is more of a, you know, if you don't, you don't. Next slide, please.
Yeah, I think it was such a unique opportunity for community academic partner where we work closely with BAIHP in the design of the materials to make sure they were culturally adapted and informed, so that they were really resonating with the population and inviting them in. I think Johnny's machines are some of the most beautiful I've seen. We did look at 600 ones across the country. And again, this is a design that they created, and really centers, messaging and coloring and components that are so clear and responsive to the community. There's a lot of machines, especially ones that have been repurposed, or placed in locations where they're not visible, that people don't even know what's in the machines. We've done qualitative research on other sites where people said, I didn't even know what that was. I thought it was a snack machine and it was going to cost money. Whereas, Johnny's machine is so clearly designed where its purpose is visible to everyone and is very inviting, and is letting them know what's inside of it and what to expect. And depending on, your program and your funding, you can work directly with the vendor to develop your own wrap. They'll, allow you again to create something as beautiful as Johnny did, or more simple. Certainly, even with repurposed machines, you could print vinyl stickers and put them on the sides again to promote the visibility and access for your communities. We did the same thing. We didn't want to just provide the resource itself. We wanted to pair that with psychoeducational information. So each of those kits has a unique insert, again, co-designed with Johnny's team, that addresses what's in the package. So, for instance, this is what's inside our overdose reversal kit. There's this insert that talks about what are the core steps you need to do to respond to an overdose emergency, and then a list of resources in our community that folks could access if they want to take next steps to support the victim, or if they themselves experience an overdose, how could they engage with substance use disorder treatment and services. So we felt that was really important to have the information, and also what could you do next. You can incorporate those QR codes, for some more engaging information. So here with this one, it's going to provide a video training on how to administer naloxone. And again, that can be tailored, any of the information, to be responsive to your local community in terms of available resources, best practices, and types of information you think would empower community members. Next slide, please. So we think this really is very, we've got a lot of evidence behind it. We know what we've seen in the research, and can support folks to be able to have the resources they need to prevent overdose deaths in their community, reduce the transmission of infectious disease like HIV and Hep C, increase engagement with health and social services, again, through those referrals and resources in a way that's non-judgmental, and then really promote holistic wellness by encompassing physical, emotional, and spiritual health. That's consistent with Indigenous values of balance and interconnectedness. And that really ties back to, why Johnny was so intentional and invested program resources in purchasing things like smudge kits, like hygiene, like menstrual. That's promoting overall health of the individual, and not just focused on overdose or infectious disease, but understanding that social determinants of health are so critical too. And if we can draw people in to start engaging with the machine in this stigma-free way, and people in the community see this just as a wellness vending machine, right, and not specific to harm reduction practices, then when people are using it, it's not perceived as something negative, right? It is part of promoting the holistic wellness of the individual. And again, through the selection of the discrete packaging, we don't know what they're getting out of the machine, but it's something that's going to help them be well. Next slide. And if you want to learn more about how to go about establishing a wellness vending machine program, what are some of the associated costs, lessons learned, what have we been putting in the kits? We have another field action report that you can scan here, the QR code, and read more. Again, just want to provide resources and information for folks as they're making these programmatic decisions, so that they can develop a sustainable and program that's going to best serve their community. But full disclosure on all the costs. Next slide. And thank you guys.
Great. Thank you so much, Dr. Herrera and Johnny. So interesting, and I'm really excited to see what kind of questions that we have. So feel free to take yourself off of mute if you have a question. It looks like in the chat there are some folks that are getting started with wellness vending machines within their own communities. But feel free to take yourself off mute or drop a question in the chat. Um, so we do have a question. How do you raise awareness or help make the community aware of the wellness machines? Maybe some best practices and maybe Johnny, what you're seeing in your community.
With our community, we promoted it through we did a ribbon cutting and we promoted through our newsletter and social media on it. We're going through some clinic renovations. So right now we're actually working on a plan to re-engage the community. A lot of it though, honestly, it at least appears to be is word of mouth in individuals. And Dr. Herrera might be able to add on how the other agencies and that she sees in her network that promote the machine. But I think that's the biggest thing is word of mouth. And I know that some agencies have machines but aren't publicly advertising them either though, due to concerns, and Dr. maybe would add some more on that as well.
So again, it depends, how visible you want this to be in your community, depending on how you think it'll be received. And then also centering the privacy, safety and confidentiality of the people who are at highest risk and need the machine the most. Johnny and BIHP are so progressive. They had a ribbon cutting. They invited everyone in to see it. They allow community members to come use it, who are not receiving Indian Health Services as well, so that they're really thinking of the total wellness of Kern County. And they have it on their website. So they very publicly have discussed this machine, so you could post it on your website, social media, you can post flyers at your clinic, or other locations in your community that would be key for driving folks in. And then, of course, word of mouth, hearing that it does work, it is actually free, and that the host site of the machine were nice, and that's been really critical, and that the machine is consistently stocked. So when the machine is not well maintained, we've seen that people lose trust in it as a resource as well. So really having that key staffing plan in place to make sure that it's being well maintained and stocked. Um, and then I saw somebody talk about costs, and that's very real. So Johnny said, and we've had incredible partnership and support in our community here with Aegis buying Johnny's machine and another machine in our community, Anthem buying several machines that are here in this community. So I think when folks have the capacity to work with their local managed care plans and asking them to do the good that they've promised to do for the community by using some of their extra dollars to invest into these interventions that we know have incredible returns on investment, for members of their plans. And then also, pushing around for opioid settlement money, right? This is another investment that other communities have used opioid settlement dollars for. And then, trying to partner with other folks. I don't know if any of you are participating with any of the Copen Accelerator teams here in California, but there are several different SOAR 4 grantees, and they're able to allocate money and budget to support these kinds of interventions again, because they're so responsive and evidence-based for overdose prevention. So tips on locations, I would say we've seen a lot of machines go into libraries, could be county buildings, could be like a food bank, could be a health center. And if any of those locations are open to allowing you to install them outside, because vending machine models have both inside and outside models, like Johnny was showing. The outside model is more expensive, but it is temperature controlled, both for environments that are very hot and very cold, so that you could stock things like naloxone, condoms, and HIV test kits, which are temperature sensitive, without worrying about the products, being affected by extreme temperatures and then becoming ineffective. So we've installed a few of these machines outside clinics and mental health access points as well. So definitely, as long as folks are willing to let you install it there and then cage it. If it's outside, I would put a cage, because of vandalism. It's an expensive resource and should be somewhat protected. But if folks are open to that, absolutely.
Yeah, and I want to add, it comes down to your community. Harm reduction itself for a lot of people has a negative stigma. So the biggest thing is in the community is promoting that wellness aspect, and that's really what's been successful for us. In conversations I have with our board members, that they've brought it up, and I'll be open about it. Like, hey, aren't you enabling them? Aren't you allowing them easy supplies? And to which my response is when have you known somebody who is using substances and is heavily addicted not to use substances just because they can't just go down the street and get it? They're going to use it, they're going to use. I go, this is going to reduce the harm until they hopefully find wellness. And in each package, there's some hope that they're going to call one of those numbers, that they'll have the resource there, and you're providing it to them. You're putting it in their hands every single time. Like, hey, when you're ready, it's just help is just a phone call away. And at that point, usually especially when I give tours, I'll take them to the machine, and we have some codes that we can use to, limited access on the supplies. And I'll say, hey, what do you feel like? I'll get them Narcan, I'll get them a hygiene kit, I'll get them a first aid kit, and I'll tell them, hey, open it up. They open it up, they look at it, they see the card. I go, that's hope right there. I go, that's hope with every supply they get out of here, regardless of what they're getting in here. And so that's usually the driving factor where I'm able to get community buy-in from our community members and our stakeholders, because then they see the benefit of having the machine. And in terms of placement, for us right now, we hadn't have it not easily accessible just because of the renovation we're going through. We're going to be demolishing our lobby. But when construction is complete, it's going to go in our lobby. It's going to be available during business hours. And it's going to be secured. I would have liked to have it outside, but the community that we have in which our clinic is, there's a lot of transients, and we've had a lot of break-ins at the clinic. And in fear of vandalism, at the time, we decided to keep it more of an indoor machine. However, our machine in Lake Isabel is a refrigerator unit, and we wanted that because it's a less concern from vandalism. But once again, as Dr. Herrera had stated, that then you're going to have to cage it. You're going to have some way of locking it up, and a lot of it's keeping it from people knocking it over. It may not be just that they don't like harm reduction. It could be that something got stuck in there. It could be that they're angry at the machine and they're taking it out on it. It could be a lot of different reasons of why the vandalism can occur. Another thing on the machine is, while it is touchscreen, what I've been told, and we haven't purchased them yet, there's these little things that go over, like for windows to protect them, that you can put on the machine, and that's been recommended to us as well. So we protect anybody from like spray painting it, cutting it up, or damaging it. Also, with placement, you got to worry about the sunlight. We've also seen like the red boxes machine where nothing works on it just because the sun's hitting directly on it. So that's another consideration as well.
I think Johnny raises another great point too, that depending on the type of machine you select, if you want one that is a smart machine, software enabled, so that you can do data tracking on the back end and also help you to do supply management and know when to restock, you have to be able to have reliable Wi-Fi that you can connect the machine to, or purchase the cellular option. Um, and if your communities, both of those are very spotty with cellular or Wi-Fi, really thinking about, then do we need to have a smart vending machine? Would it be better to have something like an naloxone box where we just open, the front of it like an old newspaper stand and put in some, drug testing strips in there as well? And how can we do this as efficiently, affordably, and feasibly for, what your community looks like? And sometimes that's just the basics of, do we have Wi-Fi and cellular? And if we don't, this box isn't going to work.
And somebody asked a question about, grant funding. Like some of it for the state of California, there's a lot of supplies that you can get and a lot of grant funds. Dr. Herrera fortunately stocks a lot of our supplies. The other supplies we had, we've got received funding from California Consortium of Urban Health. We use some of the MAT funding we received from them to buy some of the supplies, but we also have other behavioral health funding that we've utilized as well. In terms of purchasing the machine itself, that I can't say if the other grant funding will allow you to use it or not. A lot of times you can't buy equipment with funding, though. Some of them you can. But I would say talk to your grant project officer, and if the grant promotes in any type of way, if the funding's for SUD reduction, any type of harm reduction, community outreach. If you're going to put cultural stuff in there, you can tie a cultural grant potentially to it. But talk to your funder, go through your RFP that was initially announced for the grant funding, and then look at what you propose in it, and just reach out to your grant project officer. Let them know what you're going to use. There's a ton of data out there to support. Dr. put some of that information to slide as well. Just do your research, come out there very prepared, and then send them that email. It doesn't hurt. The worst that's going to happen is they'll say no. But there is a lot of data out there to support needing to use it and how it would impact your program. And as Dr. Herrera stated, you can track the analytics. She manages the analytics for us, though. It's very easy. I just email her, hey, I got a grant due. I need this information. But this date, she'll get it over to me, and I can include those numbers in our report. Of course, it makes the agency look good, but ultimately, you're helping individuals and reducing harm in the community.
Super. Any other questions?
Johnny, I was wondering, first off, just such great work that you're doing in the community. So for the stuff like the HIV STD kits and the Plan B, I was curious if, like, for example, with the HIV STD kits, is there instructions inside on how to use them? And then what do you do if you get, for example, a positive result? And then with the Plan B, is there regulations on how often they can access it, instructions on how to, it's administered, warning signs, things like that?
Yeah, those are great questions. So for our HIV test kits, we're using the OraQuick oral rapid response test, which is about 92% accurate for preliminary screening. We have extensive instructions that we developed with a local addiction medicine doctor who also specializes in HIV. And it tells folks how to read the result. We include a video. We have a picture of like how they should swab the mouth, just trying to be really clear. And then we show two pathways, right? What happens if they get a preliminary positive, which is they need to go in for confirmatory blood tests, or if they get a negative test, preliminary screening result, then this is a time maybe they want to consider PrEP, if they're engaged in some high risk behaviors related to substance use and high risk sexual behaviors. And then we outline, who can they contact in our community to take those next steps. And then also, again, like trying to offer that message of hope and support. There are resources. A lot of people live long and healthy, happy lives, with taking art, trying to break down some of that stigma and worry. What happens if I get a preliminary positive? And then like for HIV testing, because you can't test, every day, you need to be within those windows of exposure for the results to vary. We limit it to like one test kit a month per individual. So you can program things on the back end in your vending machine if it's one of those ones that uses a smart software programming model. And so you could do the same thing with Plan B, how often they can get it. And then again, designing really intentionally those inserts that talk about how to use it, what are the next steps, and then what could they also do connecting to reproductive health and the referrals in your community.
Yeah, and the Plan B is just the over-the-counter Plan B. I'm gonna drop a picture of it in the chat if it lets me, just to kind of see what the box looks like that it comes into. So all the information is pretty much there, but the resource card will have additional information on where that can be directed to get that additional information. We haven't developed the resource card yet, so we can't share that quite now, but that's going to be built out. Along with that, though, policies and procedures. Dr. Herrera fortunately supplies with a draft of vending machine policy that we're able to implement with our staff, but even then we have to then have our procedures in place. Who's going to monitor the machine? Dr. Herrera's team restocks it for us. That's great. If we didn't have that, we would need a plan of action for that. So policies and procedures are very important in making sure those involved that know what their duty is and directing staff to them as well. Because we have our community-based organization, we have community healthcare workers, we have case managers. So even if somebody has questions about these services or need additional services, we can always support them there as well.
And I dropped in a copy of the HIV testing infographic if you guys want to take a look. This is just for the community. Johnny's team needs to make this more beautiful, but the information will be largely the same.
Great. And with that, we'll wrap up the questions. Thank you so much for those amazing questions and the answers provided. Next slide, please. As we move forward in today's program, we're hoping that you might take the time to take this short survey. It will help NCUE with any future programming for webinars. Please feel free to scan the QR code, and Alyssa will also drop the link into the chat box. Next slide, please. Sharing some additional resources. We have a great toolkit on NCUE's website, an RSV toolkit. We also have the Native Health Protection Network. Alyssa will drop that link in. With this, you will get a monthly newsletter on different topics related to infection control and also vaccination. Next slide, please. NCUE also provides one-on-one technical assistance. Alyssa's going to drop our link in, but if you do have any needs with data or research, resources that you might need developed or trainings, please feel free to reach out to our staff here at NCUE. And next slide, please. Just sharing some upcoming events. The third webinar in our Community of Learning series, Navigating the Future of Healthcare, will take place on February 26th. We will be hosting a webinar on innovating through storytelling, health campaigns in the digital age. And then we also have registration open for NUCUI's annual conference, which will be taking place in Washington, D.C. Begins with board training on April 27th. Conference dates are April 28th and 29th. And then for urban Indian organizations only, we have our Hill Day on April 30th. So if you haven't registered, please feel free to do so. And next slide, please. If you'd like to subscribe to NUCUI's newsletter, we'll drop the link in as well. And this comes out every couple of weeks. Please sign up if you are not signed up already. And last slide. Great. And with that, we are going to conclude this webinar. Let's give an emoji and applause to our great speakers today. I really want to thank them for all of their knowledge and time and wisdom. This was just such a great topic, and I hope to see these vending machines in my community as well. So I hope that it's a continuing trend forward. And with that, we will end today's program. Thanks again for joining today, and we hope to see you in a webinar in the future.